بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله. I'm Dr. Hassan Razi, Associate Professor, Anatomy and Embryology. This is the second video to continue our series in the description of the body skeleton. As I mentioned in the previous video, that our skeleton is classified into axial skeleton and four appendicular skeleton, two upper limbs and two lower limbs. And for descriptive purposes, we divide each limb into four parts: girdle, proximal segment, middle segment, and distal segment. And as I mentioned, the function of the girdle is to fix the limb to the axial skeleton. So let me to apply these four concepts to the lower limb. So the first, this is the girdle of the lower limb, which is known as pelvic girdle, that is formed of these two hip bones. The pelvic girdle or the hip bone is responsible for fixation the whole lower limb to the axial skeleton. Then the proximal segment is the thigh, and the skeleton of the thigh is formed by this bone, which is the femur. And the middle segment, which is the leg, is formed by the skeleton of these two bones, the medial one, which is the tibia, and the lateral one, which is the fibula. And finally, the distal segment, which is the skeleton of the foot. So let's say to start by comparison between the skeleton of the upper limb and the skeleton of the lower limb. The girdle of the upper limb is formed by two bones, one bone anterior, which is the clavicle, and one bone posterior, which is the scapula. In comparison to the lower limb, which is formed by only one bone, which is the hip bone on each side. And the proximal segment in the upper limb is the arm, and its skeleton is formed by a humerus, while in the lower limb the proximal segment is thigh, and its skeleton is formed by femur. In the upper limb, the middle segment is known as forearm, and it is formed by these two bones, radius and ulna, while in the lower limb, the middle segment is known as leg, and it is formed by two bones, medial one, which is the tibia, and lateral one, which is the fibula. The distal segment in the upper limb is known as hand, which is formed by 27 bones, while the distal segment in the lower limb is known as foot, and it is formed of 26 bones. And inshallah, I will explain the difference in the number between the hand and the foot. Another point of comparison between upper limb and the lower limb about the joints forming. So here we have, this is the shoulder girdle, and the shoulder girdle or pectoral girdle, as I mentioned, it is formed by this joint, which is the sternoclavicular joint, and this one, which is the acromioclavicular joint. While in the lower limb, the two hip bones, we have another arrangement. The two hip bones on each side articulate with each other in the midline by this cartilaginous joint, which is known as symphysis pubis, and the two hip bones articulate posteriorly with the sacrum to form the sacroiliac joint. Then, in the upper limb also we have this joint, which is known as shoulder joint, while in the lower limb this joint is the hip joint. In the upper limb, this joint is the elbow joint. While in the lower limb we have this one, which is the knee joint, in addition to this bone, which is known as the patella. Here, this is the superior, middle, and inferior radioulnar joints. While here, sorry, because of that, it is broken here at this side. This is the superior, middle, and inferior tibio-fibular joint between the tibia and the fibula. Here, this is the wrist joint. While here in the lower limb, this is the ankle joint. Take care about the names of the bones in the hand. In the hand, carpus, metacarpal, and phalanges. While in the lower limb, these are tarsus, metatarsal, and the phalanges. So now I will shift to describe each bone separately. These are the bones forming the lower limb. So I will start with the hip bone, so that we have the same topics or the same titles as we mentioned in the upper limb. What about the site? What about the type? General features, the site determination, and the joint formed by each bone. Let me to start first with this one, which is the hip bone. Hip bone, regarding the site of the hip bone, it forms the girdle of the lower limb, which is known as pelvic girdle, as I mentioned, which is responsible for the fixation of the hip of the lower limb to the axial skeleton. Regarding the type, it is classified as an irregular bone because it hasn't a fixed shape. Hip bone is actually formed of 3 fused bones. So first, this depression here, this socket is known as the acetabulum. And the acetabulum is the landmark for the lateral surface. And it must be directed laterally as it articulates with the head of the femur to form the hip joint. Acetabulum has the following parts. This part here, which is smooth, so this means that not all the parts of the acetabulum are smooth. Only this surface, which is bounded here by black, similar to the leonate. So this is the leonate surface of the femur. This surface, which is the leonate surface of the femur, is the only part of leonate surface of the acetabulum is the only part of the acetabulum that articulate with the head of the femur. While the remaining part of the acetabulum, which is this part, this is non-articulating part of the acetabulum, which is known as acetabular fossa. This margin of the acetabulum, this is the margin of the acetabulum, which is known as labrum of the acetabulum or lib of the acetabulum. It is incomplete inferiorly to form this notch, which is known as acetabular notch. As I mentioned, where the notch means depressed border, acetabular notch. In the bottom of the acetabulum, exactly in the acetabular fossa, we have a tri-radiate cartilage. This tri-radiate cartilage ossified by the first 10 years of life. So this triradiate cartilage represents the boundaries of each of the 3 bones forming the hip bone. So again, hip bone is formed of 3 fused bones separated in the early life by the triradiate cartilage. And the triradiate cartilage extends downward like this. So by this triradiate cartilage, or sometimes known as Y-shaped cartilage, we can bound the 3 bones forming the hip bone. This bone that is starting here from the inside of the acetabulum, all this bone is known as pubic bone. And the pubic bone forms the antero-inferior part of the hip bone. So the antero-inferior part of the hip bone is formed of pubic bone. The second part of the hip bone, which is this part is known as ischium. Ischium that forms the postero-inferior part of the hip bone. And this part, this bone, which is a separate bone, this one, which is the separate bone, that forms the superior part of the hip bone, which is known as ilium. So the hip bone is actually formed of 3 fused bone, but separated in the early life by the triradiate cartilage. Okay, let me to start first with the antero-inferior part of the hip bone, which is the pubic bone. The pubic bone is formed of the following part. This is the superior pubic ramus. This is the inferior pubic ramus. And this part is the body of the pubis. So the pubic bone is formed of 3 parts. Superior pubic ramus, inferior pubic ramus, and the body of the pubis. And the body of the pubis. And the body of the pubis is characterized superiorly by the presence of this palpable bony elevation, which is known as pubic tubercle. So this is the pubic tubercle. This is the pubic tubercle. And the body of the pubis has a medial surface, which is this one. The medial surface of the body of the pubis articulate with the medial surface of the opposite pubic bone to form this joint here in the middle, which is known as symphysis pubis. Symphysis pubis. So this is about the pubic bone. Then what about the postero-inferior part of the hip bone? The postero-inferior part of the hip bone is formed by the following. This is the body of the ischium. So this part, which is the postero-inferior part, is known as ischium. It is formed of body of the ischium, and the body of the ischium has this bony elevation, which is known as ischial tuberosity, and this ramus, which is known as ischial ramus. The inferior pubic ramus together with the ischial ramus form one ramus in adult life or in adult skeleton, which is known as conjoint ramus. So the conjoint ramus, word conjoint means union or fusion, because of this cartilage in the early life will be ossified, and the inferior pubic ramus will be fused with the ischial ramus in order to form one ramus, which is known as the ischial, the conjoint ramus. The two conjoint rami, the two conjoint rami on each side will form the pubic arch. So this is the conjoint ramus of the right side, and this is the conjoint ramus of the left side. These two conjoint rami will form this arch which is known as the pubic arch. And the ischium has this spine which is known as ischial spine. So again, what are the features for the postero-inferior part of the hip bone, or which is known as the ischium? It forms, this is the body of the ischium. This is the ischial tuberosity, which is the bone for dependence during sitting. So while you are sitting, your weight is supported by this bone. This is why it is thicker than the pubic bone. And this is the ischial ramus. The ischial ramus together with the inferior pubic ramus will form one ramus, which is known as the conjoint ramus. And finally, this spine is known as the ischial spine. And the ischial spine projects in the opposite way to the acetabulum. So as I mentioned, the acetabulum is an indicator for the lateral side, while the ischial spine is the indicator for the medial side. Then, what about the superior part? What about the superior part of the hip bone, which is known as ilium? So all this bone that I'm handling between my two fingers, this bone is known as ilium. And the ilium has the following features. Number one, this surface is known as the outer surface. Why it is outer? Because it is in the same direction to the acetabulum. It is the outer surface, lateral surface, it is smooth. It is sometimes known as gluteal surface. Why? Because of the moving to this skeleton here. So this is the outer surface, because it is directed towards the gluteal region. This is why this surface, it is known as outer surface, lateral surface, or sometimes known as the gluteal surface, because it is directed towards the gluteal region. And as I will describe in one of my lectures, inshallah, it gives attachment to the group of the gluteal muscles. This surface, which is the gluteal surface, is characterized by the presence of 3 gluteal lines. This is the first gluteal line. These lines are more or less imaginary lines, or sometimes it may be ill-defined lines. This line is the posterior gluteal line. And we have another line, which is this one, which is the middle gluteal line. And we have a third line, which is this one. This is the inferior, or sometimes known as anterior gluteal line. So these are the three gluteal lines. By the presence of these 3 gluteal lines, we can divide the gluteal surface of the ilium into 4 areas. So this is an area, this is a second one, this is a third one, and this is a fourth one. So this area is the area, that lies behind the posterior gluteal line, and this area is the area that lies between the posterior and the middle gluteal line, and this area is the area between the middle and inferior gluteal line, and this area is the area below the anterior or inferior gluteal line. These lines have different names according to the different texts. This area is characterized by the presence of impression. This impression that gives attachment to a very important muscle. This impression lies above the acetabulum. This is why this impression is known as impression above the acetabulum. Impression above the acetabulum. This is about this surface, which is known as the lateral surface, outer surface, or gluteal surface. Then we have this one, this surface. So this is the bone in the anatomical position, and here this is the midline. So this surface is the medial surface that is directed towards the pelvis. This is sometimes known as pelvic surface. So here in this model, so here this is the surface. This is the surface that I'm talking about, which is directed towards the pelvis. So this surface is sometimes known as medial surface or pelvic surface because it is directed towards the pelvis. This surface is divided by this line, which is known as the arcuate line, into two areas. So this is, and here this is the medial border of the medial border of the ilium, and the medial border continue with the arcuate line. Divide the medial surface into these two areas. This depression, which is known as iliac fossa, it gives attachment for a very important muscle that will be described later, inshallah, which is known as the iliacus. So this is the iliac fossa. This surface is known as iliac fossa. And this is the iliac tuberosity that gives attachment to very important muscles supporting the sacroiliac joint. And this surface here, this surface is known as auricular surface or articular surface. Why? Because of this surface is for articulation with the sacrum to form a sacroiliac joint. So here, back to the model. So we have this joint. This joint is the sacroiliac joint, which is articulation between the sacrum and the ilium. So this is the area here. This is the area in the hip bone for the articulation with the sacrum, which is known as auricular surface or articular surface for the articulation with the sacrum to form sacroiliac joint. These are the surfaces of the ilium. What about the borders of the ilium? Ilium has the following border. This border, which is known as anterior border of the ilium, and the anterior border of the ilium carries two spines. This spine is known as anterior superior iliac spine. And this is another spine which is known as anterior inferior iliac spine. So the anterior border carries these two spines, anterior superior and anterior inferior iliac spines. And this is the posterior border. The posterior border carries these two spines, posterior superior iliac spine, posterior inferior iliac spine. And another border, which is this one. This border is the upper border of the ilium, or it is sometimes known as iliac crest. Iliac crest. The iliac crest, or the upper border of the ilium, has the following part. This is the outer lip of the iliac crest. This one. This is the outer lip. And this is the inner lip of the iliac crest. This one. And we have this broad area, which is the intermediate area. The outer lip carries a broad elevation like this, which is this one. This broad elevation is known as iliac tubercle. So this tubercle is known as this is the iliac tubercle, and the iliac tubercle is about 5 centimeters behind the anterior superior iliac spine. And the last border is this border, which is the medial border. And as I mentioned before, the medial border continues with this line, which is known as the arcuate line. So that again, what about the borders? Anterior border with these two spines, anterior superior, anterior inferior. Posterior border with these two spines, posterior superior, posterior inferior. And the upper border, or it is known as iliac crest, with outer lip, inner lip, and the intermediate area. And the outer lip has this elevation, which is known as iliac tubercle, and this border, which is known as the medial border. As I mentioned before, this is the ischial spine. And by the presence of the ischial spine, we have here these two notches, a greater one and a lesser one. So this notch is known as greater sciatic notch, while this one is known as lesser sciatic notch. Greater sciatic notch and the lesser sciatic notch. These are the general description for the hip bone. What about the side determination? How I can identify the side of the hip bone, if it is right or left? So again, we can apply the three fixed rules for the side determination. Superior from inferior. Superior by the presence of iliac crest, and inferior by the presence of this large foramen, which is known as obturator foramen. So again, as a warning, don't handle the hip bone like this, and don't consider that this is the iliac crest. This is not. Now you are handling the hip bone in a wrong position, because of the obturator foramen must be directed inferiorly. Obturator foramen directed inferiorly, and the iliac crest is directed superiorly. How I can identify medial from lateral? Medial from lateral by this large depression, which is known as the acetabulum, and the acetabulum directed laterally. How I can identify anterior from posterior? Anterior from posterior by the thickness of the pubic bone in comparison to the ischium. Because of, as I mentioned, the ischium is more thicker than the pubic bone, because of this bone is the bone supporting your weight while you are in sitting position. But we have another way to differentiate anterior from posterior by the greater and the lesser sciatic notch and the spine in between. So that this means that the greater sciatic notch, ischial spine, and the lesser sciatic notch are directed posteriorly. So that this bone is now known as right hip bone. We have a rapid way to identify the side of the hip bone. First, put the greater sciatic notch in the first web of the hand, like this. And be sure that your fingers cover completely the acetabulum. So now you are handling the hip bone by the right hand. So this is the right hip bone. If you are handling the hip bone by the opposite incorrect hand, imagine that this is the first web of the left hand, and putting the greater sciatic notch in the first web, the acetabulum is still easily seen or exposed. So now you are handling the hip bone by the incorrect hand. So again, put the greater sciatic notch in the first web and cover the acetabulum with your fingers. Now you are handling the hip bone with the right hand, with the correct hand. And finally, what are the bones forming the share with the hip bone in the formation of the joints? So the first, as I mentioned, we have here in the model, it will be more clear. So that we have this joint, which is the symphysis pubis. Second, this joint, which is the sacroiliac joint. And finally, this one, which is the hip joint. This means that the hip joint shares in the formation of these three joints. Then we'll start to describe the femur. The femur forms the skeleton of the proximal segment of the lower limb, which is the thigh. And the femur in the lower limb correspond to the humerus in the upper limb. And it is classified as long bone, as it has upper end, lower end, and shaft in between. The upper end has number one, head, and the head is directed medially in order to articulate with the hip bone in order to form this joint, which is the hip joint. And then this is the neck. This is the neck, which is more longer than the neck of the humerus. Then this is the greater trochanter, that lies lateral in the opposite direction to the head. This is the greater trochanter that lies lateral. And this small projection is known as lesser trochanter, and the lesser trochanter project posteromedial. Lesser trochanter project posteromedial. On the medial surface of the greater trochanter, we have this depression on the medial surface of the greater trochanter, which is known as trochanteric fossa. Trochanteric fossa. So these are the landmarks for the upper end of the femur. Head, neck, greater trochanter lateral, lesser trochanter posteromedial, and on the medial surface, this is the trochanteric fossa. What about the lower end of the femur? The lower end of the femur has these two large elevations, which are known as medial femoral condyle. Medial and lateral femoral condyles. These two condyles are fused anteriorly in order to form the patellar surface of the femur. Because of this part of the femur here in the model, so here this surface of the femur, which is the patellar surface, is the surface that articulates with this bone, which is the patella, in order to form a part of the hip of the knee joint. But these two condyles are separated posteriorly in order to form this notch. So these are artificial for the fixation of the skeleton, not a part of the skeleton. So the two condyles are separated posteriorly in order to form this notch, which is known as intercondylar notch. Intercondylar notch. And in relation to each condyle, we have this elevation, this large elevation. So this is the medial femoral condyle with this large elevation, which is known as medial epicondyle. Epi means above. And here also, this is the lateral femicondyle that shows this large elevation, which is known as lateral epicondyle. And also, in relation to the medial femoral condyle, we have this small tubercle, which is very important for attachment of one of the muscles of the adductor, which is known as adductor tubercle. So this small elevation is very important, which in relation to the medial femoral condyle, which is known as adductor tubercle. On the opposite side, we have here this groove, but sorry, this groove is hidden here by this screw. This groove here that lies on the lateral surface of the lateral femoral condyle. This groove is known as groove 4 popliteus for the attachment of a very important muscle in the lower limb, which is known as popliteus muscle. What about the shaft of the femur? The shaft of the femur is characterized by a long shaft. This shaft is more or less convex anteriorly. This will be helpful in the identification of the side of the femur. The shaft of the femur is smooth from all aspects except posteriorly. Posteriorly, the shaft of the femur in its middle part forms this broad border, which is known as linea aspera. Linea aspera. What is the meaning of word aspera? Word aspera means rough. The linea aspera has two borders, medial border and lateral border. These two borders will be widely separated in the lower third of the posterior surface of the shaft of the femur in order to form these two ridges, medial and lateral supracondylar ridges, enclosing in between this surface which is known as popliteal surface of the femur. Take care, this surface is the patellar surface of the femur, while this surface is the popliteal surface of the femur. Word popliteal means back of the knee. So again, this is the linea aspera. The linea aspera present only in the middle third of the posterior surface of the shaft of the femur. It is formed of two lips. These two lips will be widely separated from each other to form medial and lateral supracondylar ridges, enclosing in between this surface, which is known as the popliteal surface of the femur. In the upper part of the posterior surface, the two lips of the linea aspera will be widely separated from each other in order to form this surface, which is known as pectineal surface of the femur. And the medial lip will continue as a spiral line, and the spiral line that terminates anteriorly with intertrochanteric line, and the lateral lip of the linea aspera will continue superiorly to form this rough area, which is known as the gluteal tuberosity. And above the gluteal tuberosity, we have this crest, which is the intertrochanteric crest. And the intertrochanteric crest shows this elevation, which is known as the quadrate tubercle. So these are the features for the shaft of the femur. So note the two trochanters. The two trochanters are connected anteriorly by intertrochanteric line and connected posteriorly by intertrochanteric crest. And above the intertrochanteric crest, we have this tubercle, which is known as the quadrate tubercle. This is about the general features of the femur. What about the side determination? Again, where is the superior from inferior by the head of the femur or by the two femoral condyles that directed downward. How I identify anterior from posterior? The two condyles fused anteriorly, but they are widely separated posteriorly by this notch, which is known as intercondylar notch. And as I mentioned, the shaft of the femur is convex anteriorly. How I can identify medial from lateral? Again, by the head of the femur. So the head of the femur is your landmark for superior and the medial direction. Second, what about the joints formed by the femur? So the femur superiorly forms this joint, which is the hip joint superiorly, and inferiorly it forms this joint together with the tibia, which is the knee joint. For those postgraduate students, we have a depression in the middle of the head of the femur. This depression is known as fovea capitis. Capitis means head. Fovea means a small depression in the head of the femur. This is for the attachment of a very important ligament that will be mentioned later on, inshallah, in the hip joint lecture, inshallah. Then to proceed to the skeleton of the middle segment of the lower limb. The middle segment of the lower limb, which is known as leg, its skeleton is formed of two bones, tibia, which is directed medially, and the fibula, which is directed laterally. Okay. Let me to start with the medial skeleton of the leg. So take care that the tibia in the lower limb in adult correspond to ulna in upper limb, while fibula in adult in the lower limb correspond to radius in adult in the upper limb. And by simple vision to the tibia and the fibula, you can compare the great difference in the thickness between the thickness of the tibia and the thickness of the fibula. Why tibia is more thicker than the fibula? Because of the fibula does not share in the body weight transmission to the foot. So that your body weight will be transmitted from the femur to the foot through the tibia, not through the fibula. This is why fibula is much thinner than the tibia. Tibia is classified as long bone as it has upper end, lower end, and the shaft in between. Let me to start with the upper end of the tibia. The upper end of the tibia shows two tibial condyles. Two tibial condyles, medial tibial condyle and the lateral tibial condyle. These two condyles are much more concave in comparison to the two femoral condyles. The two femoral condyles are much more convex, and the two femoral condyles articulate with the two tibial condyles in order to form the knee joint. And in between the medial and the lateral tibial condyle, we have this area which is known as intercondylar area for the attachment of the cruciate ligaments and the menisci, as I will explain inshallah in the lecture of the knee joint. Then we have anteriorly, this is the tibial tuberosity, one of the palpable parts of the tibia, which can easily palpated immediately below the knee joint. This is the tibial tuberosity, and the tibial tuberosity lies in the anterior surface of the upper end of the tibia, so it is an indicator for the anterior direction. Then posteriorly, we have the following. In the posterior surface of the medial tibial condyle, we have this groove. So this groove is very important for the attachment of a muscle. This muscle is known as semimembranosus. Semimembranosus. So this groove is groove for semimembranosus muscle that lies on the posterior surface of the medial tibial condyle. And on the posterior surface of the lateral tibial condyle, we have this small facet. What's the meaning of facet? Word facet means smooth, circular, small articular surface. So this facet for articulation between tibia and fibula in order to form the superior tibio-fibular joint. What about the lower end of the tibia? The lower end of the tibia, the same as lower end of the radius in the upper limb. It has 5 surfaces. This is the anterior surface of the lower end of the tibia. And this is the posterior surface of the tibia that is characterized by the presence of this groove. And inshallah, we will explain this groove later on in one of our cases, inshallah, so that you can easily differentiate between anterior surface and posterior surface by the presence of this groove. Then this is the medial surface of the lower end of the tibia, which is known as medial malleolus, which is one of the subcutaneous parts of the tibia, which is easily palpable on the medial side of the ankle joint. And on the lateral surface, we have this small notch. This small notch, which is known as fibular notch of the tibia, and this is for articulation between tibia and the fibula in order to form inferior tibio-fibular joint. And this surface is the inferior surface of the lower end of the tibia, and this surface for the articulation with this bone, one of the bones of the foot, in order to form the ankle joint. This bone is known as talus bone for the articulation to form the ankle joint. So these are the 5 surfaces forming the lower end of the shaft of the tibia. Then what about the shaft itself? The shaft is formed of the following borders. This border, which is sharp subcutaneous border. This border, it is easily palpable along the anterior aspect of the leg. It is subcutaneous. It is covered only by skin and fascia. Then we have this border, which is the medial border of the tibia, and this border, which is the lateral border of the tibia, or it is sometimes known as interosseous border, because of the same, we have the same space as in the upper limb, which is known as interosseous space, which is the space between tibia and fibula. So the shaft of the tibia shows 3 surfaces. This surface is the lateral surface of the tibia, while this is the lateral surface of the tibia, and this is the medial surface of the tibia, which is purely subcutaneous also. So we have several subcutaneous parts in the tibia. The tibial tuberosity, the anterior border of the tibia, the medial surface of the shaft of the tibia, the medial malleolus, and this surface is the posterior surface of the shaft of the tibia. The posterior surface of the shaft of the tibia is characterized by the presence of this oblique line, which is known as soleal line. And this line is very important because it gives attachment to a very important muscle. And from this soleal line extend a vertical ridge. This vertical ridge divides the posterior surface into medial part and the lateral part. So by this distribution, we can give the attachment to several muscles attached to the posterior surface of the shaft of the tibia, as inshallah we will describe later on in one of our cases, inshallah. So that again, the posterior surface of the shaft of the tibia shows oblique line. This line is known as Solean line. So the Solean line divides the posterior surface of the shaft of the tibia into upper triangular area for the attachment of a very important muscle and the lower part. The lower part is divided into medial and lateral by this vertical ridge, as we will explain later on, inshallah. The next concept, how I can identify the tibia right or left. Again, the two tibial condyles are directed superiorly, while the medial malleolus directed inferiorly. This is how I can differentiate between superior and inferior. Medial from lateral by the medial malleolus. So the medial malleolus is your landmark for the lower and medial part of the shaft of the tibia. Then anterior from posterior by the tibial tuberosity. So the tibial tuberosity differentiate anterior direction from the posterior direction. So by this distribution, this tibia is the right tibia. Then let me to shift to the lateral skeleton of the leg. Lateral skeleton of the leg, which is formed by the fibula. So this is the fibula. Fibula forms the lateral skeleton of the leg, and it is classified as long bone, as it has upper end, lower end, and shaft in between. The upper end of the fibula shows the following. So it has a small facet in its upper part. And as I mentioned, this facet articulates with a corresponding facet on the posterior surface of the lateral tibial condyle to form this joint, as I mentioned, which is the superior tibiofibular joint. And it has this small projection, which is known as a styloid process of the fibula, and this narrow constriction is known as neck of the fibula. These are one of the very important landmark for the fibula, because of the neck of the fibula is the commonest site for the fracture of the fibula. So again, the upper end has a head, and the head carry facet. This facet for articulation with the corresponding facet on the posterior surface of the lateral tibial condyle, and this small projection, which is known as a styloid process. Then we have the neck, which is a narrow constriction between the upper end and the shaft, which is the commonest site for the fracture of the fibula. Then what about the lower end? The lower end of the fibula, it is sometimes known as lateral malleolus. And the lateral malleolus, it is commonly palpable on the lateral aspect of the ankle joint. So this is the medial malleolus, and this is the lateral malleolus. And the lateral malleolus has a facet. This facet also for articulation with the talus. So here from this figure, you can see that the tibia and the fibula, these two bones together form a socket. This socket forms the upper boundary of the ankle joint, while the lower part of the ankle joint is formed by this bone, which is the talus. So the talus articulate with the medial malleolus, with the inferior surface of the tibia, and with the lateral malleolus. And behind the facet, we have this depression. This depression behind the facet on the lateral malleolus of the fibula, this depression, which is known as malleolar fossa, it is very important for the attachment of ligaments supporting the ankle joint, as I will explain later on, inshallah. Then what about the shaft? What about the shaft? So in order to determine the borders of the shaft, because of this, sometimes fibula is rich with ridges and elevations. So in order to determine the borders, first you must determine this triangle. You must determine this triangle. This triangle is known as subcutaneous triangle of the fibula that lies on the lateral surface of the lateral malleolus. So by the upward extension of the apex of this triangle, will be the anterior border. Will be the anterior border of the shaft of the fibula. Will be the anterior border of the shaft of the fibula. This means that exactly to pass posteriorly, will be the posterior border. The posterior border of the shaft of the fibula. And here we have inside, will be the interosseous. Will be inside here. I think it is more clear from this view. Will be the interosseous border, of the fibula. So this means that the fibula has three surfaces. This surface of the fibula, this is the lateral surface, and this is the anterior surface, and this surface, this is the posterior surface of the fibula. What about how I can determine the side of the fibula? Head of the fibula together with the styloid process directed superiorly in comparison to the lateral malleolus directed inferiorly. So this is how to differentiate between superior and inferior. How I can differentiate medial from lateral? By the presence of the malleolar facet and the malleolar fossa. So the malleolar facet and the malleolar fossa are your landmark for the medial side. Anterior from posterior, the malleolar fossa lies behind the malleolar facet. Malleolar fossa lies behind the malleolar facet. So this is the right fibula. What about the joints formed by these two bones? Let me to start with the tibia. Tibia form the knee joint. And from this figure, tibia together with the femur and the patella form the knee joint. Fibula does not share in the formation of the knee joint. Again, fibula does not share in the formation of the knee joint. This is second. Tibia form the superior tibiofibular joint, middle tibiofibular joint, inferior tibiofibular joint, and lastly this joint, which is the ankle joint. What are the joints formed by the fibula? Fibula forms the superior tibiofibular joint, middle tibiofibular joint, distal or inferior tibiofibular joint, and this one, which is the ankle joint. So the fibula shares in the formation of the ankle joint, but does not share in the formation of the knee joint. Lastly, in order to finish the skeleton of the lower limb, so what about the skeleton of the foot? The skeleton of the foot. Foot has the same arrangement as hand. But the difference is in the names of the bones. Skeleton of the foot. Foot has the same arrangement as hand. So these bones that I am handling by my left hand, this group of bones are known as tarsus or tarsal bone. Then these are the metatarsal bone and phalanges. In comparison with that of the hand carpus, metacarpal, and phalanges. And for descriptive purposes, take care that in foot, we start our description from medial to lateral. In comparison to hand, hand starts from lateral to medial. Why? Because of the thumb or the pollex in the hand is directed laterally in the anatomical position. While this is the big toe or the hallux. So this is the first toe or hallux. This is the first finger or pollex. First finger or pollex directed laterally. First toe or hallux directed medially. And one of fatal mistakes in anatomy. The names, we have digits. These are digits, whatever in hand or in foot. But the digits in hand are known as fingers, while digits in foot are known as toes. So please don't apply the opposite term to any of the opposite limb. So the digits in the upper limb are known as fingers, while digits in the lower limb are known as toes. Okay, back again to the names of the bones of the foot. So as I mentioned, these are the tarsal bones. The tarsal bones have 7 bones in comparison to the carpus with 8 bones. So this is the difference in the number between number of bones in hand and the number of bones of foot. Hand contains 27, while foot contains 26. Why? Because of the carpus are formed of 8 bones, while tarsal are formed of 7 bones. These 7 bones are, this bone, this large bone, is known as the calcaneus or bone of the heel that support your weight during standing. So this is the calcaneus or bone of the heel. This bone is talus. This bone is known as talus. This bone is calcaneus. This is the talus. Then the cuneiform bone. This one is the navicular bone. This is the navicular bone. While this one is the cuboid bone. And these 3 bones are cuneiform bones. Median, intermediate, and lateral. Again, because we are starting our arrangement in the foot from the hallux or from the big toe. Again. Number 1, this bone is the calcaneus or the bone of the heel. Second, talus. Third, navicular bone. Then cuboid bone, and the 3 cuneiform: medial cuneiform, intermediate cuneiform, and lateral cuneiform. 1, 2, 3, 4, 5, 6, 7. 7 bones forming the talus in comparison to 8 bones forming the carpus. Then, what about the metatarsal bones? Here, these bones are known as metacarpal in hand. but in foot these are metatarsal bones. And they are named numerically from medial to lateral in comparison to the upper limb. Metacarpal named numerically from lateral to medial. First, second, third, fourth, fifth. From lateral to medial. But here, this is the first metatarsal, second metatarsal, third metatarsal, fourth metatarsal, fifth metatarsal, from medial to lateral, and these are the interosseous spaces. And the same as in hand. We have 14 phalanges. The same in hand. The hallux or the big toe has 2 phalanges, proximal and distal, while the lateral 4 toes, here medial 4 toes, medial 4 fingers in hand, but in the foot or in the lower limb, lateral 4 toes, each has 3 phalanges, proximal, middle, distal, proximal, middle, distal, proximal, middle, distal, proximal, middle, distal. And as I mentioned, we have here several intertarsal joints, and we have these joints which are known as tarso-metatarsal joint. These joints are metatarso-phalangeal joint and interphalangeal joint. The same as in the upper limb, the hallux or the big toe has only 1 interphalangeal joint, while the remaining lateral 4 toes each has 2 interphalangeal joints, proximal and distal interphalangeal joint.